Welcome to Conversations on Healthcare. This week we welcome renowned translational science leader Dr. Eric Topol on concerns about our lagging response to the rising COVID variants and lack of vaccine uptake. Now, here are your hosts Mark Masselli and Margaret Flinter.
Our guest recently wrote the following: "It's frankly sickening to watch this virus continue to outrun us, knowing we are so damn capable of getting ahead of it." We're going to learn more from the writer himself. Dr. Eric Topol is one of the most prominent and prolific COVID experts, as well as one of the top 10 most cited medical researchers.
Dr. Topol is the founder and the director of the Scripps Research Translational Institute, and we've always learned a lot from his visits, including the last one, which was in December, when the Delta surge was occurring.
Dr. Topol, thank you for returning to Conversations on Healthcare.
Thank you. I think you were getting on the Omicron surge in December rather than Delta.
That's right.
Possible.
It's hard to keep track, I know.
I have lost track.
All right, good to be with you both.
That's great. Well, let's start with the COVID Omicron variant BA.5, and it has three key mutations in its spike protein, and that makes it better at infecting cells and better at slipping past our immune system. What more can you tell us, and what keeps you up at night about BA.5 and other offshoots that could be on their way?
Yeah, well, I think the key here is that although there's reluctance to accept it, the virus is getting worse. The variant BA.5 is the worst variant. And I don't say that because it's causing the most deaths or hospitalizations. I say it because if you look at its biology that you just mentioned, the immune escape, the ability to have growth and fitness advantage that we haven't seen before. Mm-hmm. So if you go look at the properties of the virus, it's getting worse. Also, parenthetically, it's lasting longer, contagiousness. So instead of what might have been 7 days or 8 days, it's clearly longer now. I don't know anyone in my network now at the moment who isn't either infected or reinfected almost. It's just extraordinary. So it's spread potential, we're seeing it. And the most reinfections that we've seen since the beginning of the pandemic. So these are qualities that should raise concern because the virus has not finished its evolutionary arc. There's more to come, unfortunately. And so rather than being complacent and capitulating, we should be arming up for how we can get ahead of the virus, which we've never done since the pandemic began.
I couldn't agree with you more about what we're seeing in our social networks. I'm going to go off a little bit to the side on the issue of COVID for a moment and speak about a person, because we just learned recently that Dr. Anthony Fauci has announced that he's going to step down from his post by the end of President Biden's first term. I think he played a very forward and prominent role, certainly in this first couple of years of the COVID vaccine. What do you think about the role that he played? How effective was he as a communicator? And do you think he helped America to better understand what they needed to do? Any thoughts on what might have been done differently?
Well, I think he's been extraordinary in his ability to try to communicate and just work tirelessly. He really is indefatigable. He's an extraordinary person and scientist and physician. So he's done his absolute best, but he's been under profound attack. I don't know how he's withstood this. I don't know how he can go on for a couple more years with all the things that have been done to personally ad hominem go after him. It's a reflection of the anti-science, anti-vax, organized efforts that we have right now. And he's been, right in the middle of it and bearing a lot of the brunt, like so many other people, but especially him because he's been for much of the pandemic center stage.
I want to pick up on the thread of anti-science, anti-vax, and you issued a clarion call that we need to apply money, pressure, and government strength to create a variant-proof COVID vaccine. And you wrote in the LA Times that, I quote, that nasal sprays deserve an Operation Warp Speed-like program to accelerate their success. There seems like all this is really a no-brainer. I'm just wondering what the hurdles are, and are part of the hurdles that anti-vax, anti-science effort that's going on. I don't think we have the attention of our government in terms of the investments that they need to make. And I guess as part of that, are there other drugs in the pipeline, in addition to the nasal spray, we need or should be keeping an eye on?
Well, you're making some important points there. A lot to go over. Firstly, back in January 2021, in Nature, Dennis Burton, who chairs immunology at Scripps Research, and I wrote about the need to pursue a variant-proof vaccine. And here it is a year and a half later, and we still haven't done it. We have no shortage of candidates, that is, ways that we can induce broad neutralizing antibodies that, at least theoretically, if not in practice, would knock out any variant that this virus could present to us. But we haven't yet developed a program because it's been politically not supported with funding. And so basically all these great discoveries sit in academic labs all around the country and the world, and there's no organized effort to develop a variant-proof vaccine that has great promise. And the nasal vaccines are a somewhat similar category. There's 3 that are in phase 3 trials, but there's no Operation Warp Speed-like initiative. Remember, that was a $10 billion, which is a small amount these days, considering we spent trillions. $10 billion to basically de-risk and accelerate the first vaccines, which worked really well. But we've never done something like that again. And we and many others have been calling for that. That is, we shouldn't be at all discouraged. We can get ahead of this virus. We can do this. We're just not doing it. And then add to the woes concerns that I have is that we likely will develop Paxlovid resistance over time. Millions of the blister packs are going out, every week or month here, and we're going to see the virus in Mpro, the main protease. It's going to find a way to resist Paxlovid. And where is our backup? And again, we have a long list of really good candidate backup pills, but we're not, pursuing those in the accelerated way we could. So the point is, the potential to get ahead of the virus is vast, but we're just doing like variant chasing and not putting in the aggressive pursuit that we need to do.
Well, I understand that we do have another vaccine probably joining what's available now. CDC is about to review Novavax's COVID-19 vaccine, at least for emergency use in adults, and the FDA already gave its okay. I understand there's some concern about severe allergic reactions as a potential side effect. And then there was a poll by Morning Consult that said that 77% of unvaccinated U.S. adults probably or definitely would not get a protein-based vaccine, such as this one from Novavax, which kind of leaves us with the question, is there any vaccine that today's unvaccinated adults are likely to be willing to get? And is there anything particular you would say about this one in terms of advice for people who maybe until now have said no? Anything that would be inclined to change their mind?
Well, as already touched on, this entrenchment, anti-vax, anti-science, has been profound, and it's never been adequately countered. An aggressive strategy to deal with the dis and misinformation, unfortunately. And we are ranked 67th in the world behind Rwanda, Iran, Sri Lanka, and many countries on the list you would never have imagined that for boosters, no less primary vaccination. There's no reason why Novavax wouldn't be one of the good vaccines to take, and hopefully it also be shown to be useful as a booster. There are new data out today to show it works well against Omicron variants like mRNAs with boosting. So I'm not optimistic, given the entrenchment, that we can break this vaccine at this point, this vaccine resistant. It's really unimaginable how profound that is. And it's the same thing that's holding back our aggressive get ahead plan. It's the same problem. People say, oh, it's over. The pandemic's over. Wrong. But that's the same group that are anti-vax, that are an anti-science. The science here is what's so exciting, to get ahead of the virus. And we are just ignoring it or not giving it any priority.
You know, you said the CDC has failed to warn Americans about the subvariant spread. But as you said, it seems like the public has tuned us out. And I'm wondering what the prescription might be for the public health community in terms of trying to right the ship, if you will, and get us headed true north in terms of following the science and following the data. We simply haven't been able to engage the larger public. Are they just worn out, or do we have to really adopt a new message to reach them?
Well, we're all tired, right? I mean, nobody can say that they think this pandemic is a good place to be, still in it. And it's not at what I would consider an endemic steady state phase whatsoever. Mm-hmm. So the problem is our CDC has been a profound disappointment. Rather than getting the message out a year ago, when we knew about how boosters were life-saving, they resisted that for months, and there was infighting with other agencies. And still today, that's why our boosters, among age 50 and older, 4 shots, only 1 in 4 Americans have had that, which is amazing, actually. And that's where we are basically so vulnerable. But beyond that, how can you possibly recommend a 5-day isolation still, when we know the virus lasts 10 days or not longer for contagiousness? It's unfathomable. And so the lack of a warning until last week, when finally there was a public, and basically the message is, we got this. No, we don't have this, because they haven't gotten the boosters right. They haven't gotten the isolation right. They haven't gotten a plan right to get ahead of the virus. Until that happens, they don't have this. And it's an illusion. So we look to the CDC to provide leadership to prevent disease. But if anything, they're spreading it, which is extraordinary, by not having appropriate isolation guidelines and messaging.
Well, we could spend the rest of our time talking about that issue. I couldn't agree with you more on the that length of time that people should be quarantining. But I wonder if I can ask you about this issue of COVID and children, and the really everywhere slower than I would have hoped uptake, particularly some states in the Southeast. Parents are so slow to inoculate their children that we're seeing fewer vaccine doses even ordered from the state supply. What's going on there? And are you seeing any data around adverse effects in children from not taking advantage of the vaccine, of this youngest group of kids?
It's very discouraging, again, that the whole anti-vax influence also being felt with children. First, we saw it in the 5 to 11 group, and there's really no risks there that are beyond the local, the usual things that we see from, as far as like myocarditis, pericarditis. It's just, it basically is not an issue. And then when we have the 6-month to 5-year-olds, it's even worse. So here we have such a large population of children that are at risk. And a lot of them did have BA.1 infections in the early part of this year, but that doesn't protect them from BA.5 or subsequent infection. So here we have a great way to keep them insulated from getting very sick, from spreading their infections, from the long COVID that can occur in children. And we're not doing it. And it's a shame, because so much work went into getting pediatric vaccines validated.
Right.
It's all part of that same continuum. And we're one of the few countries now that have gotten down to, the 6-month level, but we don't have it being implemented at any scale in the country because of the anti-vax movement.
I'm trying to figure out what the practical suggestions are to people around their daily life, and talking more about adults in terms of masking up. How effective are those KN95s and N95s? It seems that part of the strategy here, or the results have been that the government and the like are trying to keep businesses open, and they haven't figured out any sort of nuanced conversation with people. How important are masks here so that you can continue to engage in social conversations with your friends and your neighbors and your families? What's the fine line for people in terms of that they may be able to follow so they're not getting infected?
Well, of course, it's not just masks. Like you said, the good masks, high quality KN95, N95, which help. It's also distancing. It's also filtration and ventilation, all those things that we're not doing largely, right? If we did all those things, like how can we not have masking in public transport?
Right.
It's incredible. If you go on a plane now, you rarely will see people with masks, and that's in the airport and all kinds of, you name the type of public transport. I mean, if you go to Mexico, they use masks. I mean, we're distinct denialism of the benefit of some masks, but it goes beyond that. We're not doing the simple things that would help. They're not foolproof by any means. This is a hyper infectious version of the virus. So none of these things are going to be 100%, but they help. In the meantime, we use this as a chance to get ahead of the virus so that our vaccines work better in the future, that we have other backup drugs, that we have nasal spray that will protect us from infection and transmission, because basically we've lost that edge largely. So it's just, these are temporizing measures to help us get through to when we have something better to offer people. And we're not using them.
And although I hate to raise the specter of a new threat to health as we talk, the World Health Organization monkeypox committee is getting ready to meet and decide if it reaches the definition of a pandemic, but we're certainly reading a lot about it in the press. How do you see this viral disease? What's likely to be the pathway in the coming months with monkeypox?
Well, I'm concerned about it, but I don't look at it in anywhere near the issue that we're facing with SARS-CoV-2, which obviously has caused millions of deaths and worldwide turmoil. I mean, monkeypox is a serious virus and it's spreading and it's very concerning, and we aren't keeping up in terms of vaccines and, sure, but it's in a different, order of magnitude of concern that, what we don't want to do is get distracted, which is what's happening.
Right.
We can't afford to be distracted. We got so many things going on between, banning abortions and the war in Ukraine and monkeypox. I mean, you can add a long list inflation, that we're missing what's really critical, which is we still have COVID and we haven't done anything to contain it. And that's what we really need to do. And I see these things, unfortunately, as distractions from the main agenda.
We had Dr. Fauci on in February 2020, just as the virus was making its way from China over to the United States and around the globe. And the one thing he told us was the coronaviruses mutate. And you've been talking about the evolution of the virus itself. Walk us through where are we headed? Obviously, its transmissibility has been high. Will its lethality get higher? I mean, do we know? Are we able to track the evolution of a virus like this, or are we sort of waiting for it to play its own hand?
Yeah, I don't think we're ever going to see lethality get higher because we have this immunity wall, right? I mean, we have parts of our immune response that have been primed by vaccines and boosters and infections, right? So that's the point, is that the virus keeps evading our immune system more. And there's now signs as of Friday from the new CDC report that we're losing some of that protection against hospitalization that we had just from going from BA.1 to BA.2.1.2.1. So that trend, it's not like an on-off switch. It's just like this attrition of protection. We'll see probably more of that over time with whether it's sigma or pi, whatever the new Greek letter or family. Eventually, we're going to get out of the subvariants and we're going to get into a new family. And who knows what the name of that's going to be, but it's going to happen. And it's just, when. whether it's before the end of the year, early next year. And we're not at all prepared for that because the virus still has room to evolve.
Well, perhaps a final question. It's almost flu vaccination time. Hard to believe we're in July, but in August, I'm sure we'll be back out there. Share your thoughts on the importance of everyone getting a flu vaccine this year and how that preventative step fits into everything else that we've been discussing.
Well, yeah, flu vaccines, they're good and they do help raise your immunity across the board. So that's good. But I'm glad you asked me that as a final note. And that is, flu vaccines don't work very well. You know, their effectiveness doesn't get to 50%. We've had vaccines against this virus at 95%. There's never been a flu vaccine at that level.
Right.
That should give us optimism that this virus can be squashed, that we can get ahead of this virus. We were in terms of a great effective vaccine, then the virus evolved. So this is a different virus. We can do much better. We just have to do it.
We've been speaking with Dr. Eric Topol, director of the Scripps Research Translational Institute. Thank you, Dr. Topol, for the clarion call and vision that you've had all during the course of this pandemic. And thanks to our audience for joining us. You can learn more about the conversations on healthcare and sign up for our email updates at www.chcradio.com. Thank you again, Dr. Topol.
Thank you. Thanks for having me.
Yeah.
Take care. Bye-bye.